Burn injury management involves a systematic approach aimed at minimizing tissue damage, promoting healing, and preventing complications. Care depends on the severity and depth of the burn, the affected body area, and the patient's overall health. Below is a detailed overview of burn management. 1. Initial assessment and stabilization. Primary survey ABCDE. Airway. Ensure the airway is patent. Consider intubation if there is airway swelling, inhalation injury, or carbon monoxide poisoning. Breathing. Administer 100% oxygen and monitor for signs of respiratory distress. Circulation. Assess for signs of shock. Establish IV access and begin fluid resuscitation if necessary. Disability. Check neurological status. Exposure. Remove clothing, jewelry, or constrictive items to prevent further injury. Protect the patient from hypothermia. Secondary survey. Evaluate the extent and depth of burns. Identify associated injuries, fractures, head trauma. Obtain patient history, including the mechanism of injury and comorbidities. 2. Classification of burns. By depth. Superficial, first degree. Redness, pain, no blisters, e.g. sunburn. Partial thickness, second degree. Red, blistered, moist, painful. Full thickness, third degree. White, charred, dry, insensate. Fourth degree, extends to muscles, tendons, or bones. By total body surface area, TBSA. Use the rule of nines, Lund and Browder chart, or Palmar method to estimate TBSA. NAF 3. Fluid resuscitation. Parkland formula. Fluids equals 4 times K green body weight times text TBSA percent burned. Administer half in the first 8 hours and the rest over the next 16 hours. Use Ringer's lactate as the fluid of choice. Monitor urine output, 1.5 to 1 milliliters per kilogram per hour in adults, 1 milliliters per kilos per hour in children to assess adequacy of resuscitation. 4. Wound care. Cleaning. Use sterile techniques to clean the wound with saline or mild antiseptic solutions. Debridement. Remove necrotic tissue to prevent infection and promote healing. Dressing. Apply non-adherent antimicrobial dressings to prevent infection and maintain a moist wound environment. Options include silver sulfadiazine, silver impregnated dressings, hydrocolloid or hydrogel dressings. Use multimodal analgesia, mild pain, paracetamol or NSAIDs, moderate to severe pain, opioids, e.g. morphine. Consider anxiolytics for associated anxiety. 6. Infection prevention. Topical antibiotics. Apply antimicrobial agents, e.g. silver sulfadiazine or mefenide acetate on burns. Systemic antibiotics. Not routinely used, but may be required for confirmed infections or sepsis. Monitor for signs of infection, fever, increased wound exudate, redness, or foul odor. SHAR 7. Nutrition. Burn injuries increase metabolic demands. Ensure adequate calorie and protein intake. Use enteral feeding early to support wound healing. Supplement with vitamins, e.g. C and E, and trace elements, e.g. zinc. 8. Surgical management. Escharotomy for circumferential burns that compromise blood flow or ventilation. Skin grafting for large, full-thickness burns to promote healing and prevent contractures. Flap reconstruction for deeper burns involving underlying tissues. 9. Physical therapy and rehabilitation. Begin early mobilization to prevent contractures and maintain joint function. Use splints and compression garments to manage scarring. Provide psychosocial support to address trauma and body image concerns. 10. Special considerations. Inhalation injury. Monitor for respiratory complications, e.g. carbon monoxide poisoning, ARDS. Administer bronchodilators or nebulized heparin if needed. Electrical burns. Monitor for arrhythmias, rhabdomyolysis, and compartment syndrome. Chemical burns. Flush with copious water. Neutralize only if the specific chemical and its antidote are known. 11. Long-term follow-up. Regular assessments for scar management. Psychological counseling for post-traumatic stress or anxiety. Reconstructive surgeries for functional or cosmetic needs. Effective burn management requires a multidisciplinary approach involving emergency care, surgery, nursing, physiotherapy, and psychosocial support. Tailoring care to the severity and type of burn ensures optimal recovery.